This video is all about medical staff and the levels of healthcare providers here in the United States and specifically in New York State. Okay, so let's begin together. The first level is a patient care technician, which is a PCT or a tech. They typically work most in a hospital setting. They need at least a high school diploma as their education, and one of their main roles is checking vital signs, coming into a patient's room and checking their blood pressure, heart rate, oxygen level, respiratory rate, height, weight, some of that basic information that other providers need to provide good care. They also help with daily living and comfort. So they provide direct patient care by helping patients to the bathroom, helping them shower or bathe, helping position them differently in a chair or a bed, and helping people with walking if that is one of their goals. So a patient care tech is very important, as all care providers are, to patient safety and care. The next level is a licensed practical nurse, or an LPN. This is a nurse that has a 2-year college degree. They also can check vital signs. They can assess patients, so they can come into the room and you can explain what problems you're having, and they will talk to other nurses and other providers to help you. They can give medicine if it has been prescribed by another provider, and they may work in nursing homes, hospitals, or doctor's offices. A next level of nursing is a registered nurse, which is an RN. This requires a 4-year college degree. These nurses also can assess patients, and these nurses can provide patient education. They can give you advice and rules to follow for when you leave the hospital or leave a doctor's appointment. They can tell you how you might feel after receiving a vaccine, a shot, and they can give you aftercare instructions. Also, they can administer medications when provided by an upper level provider, and they can check vital signs. Important to know in New York State is that a nurse practitioner, NP, physician's assistant, PA, and doctor, MD or DO, all have the same amount of power in New York State when it comes to providing care to patients. All of them can evaluate patients, diagnose conditions, which means tell you the name of a condition or an illness that you have, and they can all prescribe treatment. That means they can all prescribe medicines at a pharmacy. They can give recommendations for specialists. They can prescribe different kinds of therapy, physical therapy, occupational therapy. So all of these people have the same power in New York State to support you and your health. They've just gotten to their jobs in different ways of education. Nurse practitioners and physician's assistants both have master's degrees. Okay? A doctor has a medical degree, but all of them can do the same things in regard to your care. Okay, so I like to tell my students, if you call your doctor's office and request an appointment, and they say the doctor cannot see you until next week, but the PA is available today, or the NP can see you tomorrow, take those appointments. They can do the same things the doctor can do. Okay, and this is often very different from other countries and other health systems. Our nurse practitioners and PAs both have the power to prescribe medicine and support you in the same way that a doctor does here. Thanks so much for watching.